Mr. Speaker, I believe that probably everybody in the House and in the Senate have someone that they know or knew that had breast cancer or another form of cancer. My first wife, Barbara, died about 8 years ago from cancer. And I'll never forget the day that she felt a lump in her breast. She thought it was a fibrous tissue. She'd had those before. And she didn't want to go have herself tested. And I said, I want you to go to the doctor and have him look at that. And he did. And she called me a couple of days later when I was out here in Washington, and she started crying. And she said, I've got breast cancer. And of course, we went back home. I went back home, and we went to the doctor and went through all the things that you have to go through, including the chemotherapy. And for any family that's gone through that, they know how very difficult it is. Had she had a mammogram earlier, she might not have had the cancer metastasize and go to other parts of her body, and she ultimately passed away. It was a tragic thing to watch that. And that's why this bill, although it may sound like just a resolution, is very, very important. One of the things in the health care negotiations that's been going on that's concerned me a great deal is there was some talk about limiting mammograms to people in their 50 and above, and the people 40 and above, between 40 and 50, might not be included in getting mammograms and having coverage for that, either under the health plan or insurance plans. And I want to read you a letter from a young lady from my district in Noblesville, Indiana, Tanya Lewis, and here's what she says. I was diagnosed with triple-negative breast cancer in May of 2008 at age 39. I found this lump myself. I had a baseline mammogram at age 35, and it came back clear. So at age 35, she didn't have a problem. I was advised not to have another mammogram until age 40. The radiologist that read my mammogram at age 39 told me that if I would have had a mammogram at age 36, 37, or 38, most likely I would not have had to have a mastectomy and have 14 lymph nodes removed. My cancer spread to my lungs and chest while after doing chemotherapy and radiation. After completing 9 different types of chemo as of November 24th, 2009, I am finally cancer-free. Please fight for us, breast cancer survivors, and the young women in the future. I believe mammograms should be available and paid for by insurance companies at any age. And when we talk about limiting breast cancers to people 50 and above, I think we make a mistake, because breast cancer does kill one in every 8 women are going to get breast cancer in their lifetime, and it's going to affect families across this country. So I think we ought to make sure that we don't start limiting mammograms to only people 50 and above. It's been 40 and above for some time. In this particular case, it wouldn't have helped her because she was in her 30s when she developed breast cancer. It's a very, very serious thing, and unless somebody has lived with it, they don't understand how horrible it is to watch somebody pass away going through the travails of cancer. So I want to congratulate my colleagues on sponsoring this bill, and I hope in the negotiations on the health care bill, regardless of how we come out, that we make sure we take care of these women that are suffering from these things and catch it before it becomes terminal. I yield back the balance of my time.
The gentleman from Massachusetts.
Mr. Speaker, I thank the gentleman for his remarks. And